Hello again, this is Ditta Depner. I'm a childbirth educator, and today I have a special guest here, Dr. Mate Gabor, who is coming from Canada to talk about stress and things that influence birth and women and childbirth in general. So thank you so very much for making this interview with me. I want to ask, how does stress of a pregnant woman affect her baby in the womb?
So there are many studies now that show that babies are affected by the woman's emotional states. Because stress is not just an emotional event, it's a physical event. So when you're stressed, your body's putting out stress hormones, adrenaline and cortisol. And if anybody who is even an adult knows what it's like to have a lot of adrenaline, it's, there's a lot of movement, there's a lot of nervousness with adrenaline sometimes. Well, can you imagine with a little baby inside the womb? And the cortisol and the adrenaline of the woman goes through to the baby, through the placenta. So the baby actually experiences high levels of stress hormones. And that has an impact on the baby's development. And if it's chronic stress, it goes on and on and on. For example, if the woman is living in poverty or living in a bad relationship or is being abused or there's a war going on, that can negatively affect the baby. And we know that women who are stressed a lot during pregnancy, their infants have a higher risk for learning problems, behavior problems, mental health problems, even addictions and so on. So that period in the womb, even though we used to think it's just a safe period that doesn't matter, it really actually makes a difference. So it's very important that pregnant women get all the support they can with the stresses in their lives.
Can also a negative diagnosis make her feel stressful and influence the child inside the womb?
A negative diagnosis?
Yes, like she's worrying about her ultrasounds where the doctor tells maybe there is a problem, but it's okay after all. Yeah. And she's going to stress from nocebo effect.
Yeah, the problem with I used to deliver a lot of babies as a family doctor, and I really was watching the whole system change. The more tests we develop, the more tests we do.
Yes.
And all of a sudden, everybody has to have an ultrasound.
Yeah.
And then there's an ultrasound, and you pick up some abnormality. Now you have to have another ultrasound, and you create all this worry and all this anxiety. Now the reality is that these tests have a purpose, and they can play a very important role in child care in some situations, but we overdo them.
Yes.
We do way too many of them, and then we have to look up every result and follow up every possible problem, and that creates more anxiety in women. So I think we're overdoing it, not just in the pregnancy field, but certainly in this field we're interfering way too much, and we're creating way too much anxiety.
Yeah, that's right. I wanted to ask you, how does an elective C-section affect birthing memory of a newborn?
Well,
it's elective.
I understand. First of all, let's agree that sometimes it's important to have an elective C-section. I mean, there's some good reasons for it. If for some reason vaginal birth would pose some serious complications to the baby, then sometimes it's a good idea to have an elective C-section.
Yes.
But I can tell you something. Where I live in British Columbia, Canada, the cesarean section rate is now over 34%, 35%.
It's higher here.
It's higher here.
Yes.
Which is absurd.
Yes.
Because what we're saying now is that a third of women or more cannot deliver naturally anymore.
Yes, because of the fear.
Because of the fear. Now there should be some cesarean sections that can save lives. They can save the life of the baby, they can save the life of the mother. Maybe 8 or 9%, maybe 10%.
Yes.
But not 30%, not 35%, not higher. Now, natural birth is not just a physical process of the baby being pushed out of the womb, and that's it. It's actually a process of preparation for life. So during natural birth, in the baby's bodies are released hormones. We call them a love cocktail.
Yeah.
Hormones that then promote the bonding between the mother and the infant. And actually, birth is meant to provide that experience of hormonal change and immersion in these love hormones of both the mother and the baby, so their bonding becomes that much stronger afterwards. Now, obviously, with selective selection, and that comes from the pushing and the pressures in the vagina and in the womb. When you do elective C-section, that doesn't happen.
Yeah.
And also, of course, it's an operation, so it's not a big operation, but it's an operation, and the mother is not immediately able to bond with the baby exactly the same way as she might if there been a more natural birth. And we know that that bonding is just very important for the long-term relationship. Now, I'm not trying to scare people. I'm not saying that it's terrible if you have a C-section. It may be necessary, but let's recognize the value of natural birth, and let's not interfere with it.
Mm-hmm.
And in today's world, we're interfering with it way too often, and that actually has an impact on child development later on.
Some doctors say that C-section is safer than natural birth for the baby. That's an issue. I don't agree necessarily. Can you say some things about that?
Yeah, and you could also say that taking out everybody's gallbladders will prevent gallbladder attacks, so everybody should have their gallbladder taken out, or it's absurd. I mean, it's a question of from which point of view are you looking at? Are you looking from fear, or are you looking from reality? It's true, if everybody had a C-section, you would avoid certain birth complications. That's true. But what harm are you doing? You're doing a lot of harm. So safety in the sense of avoidance of problems cannot be the only issue in any medical decision making. In fact, we should have to justify every time we interfere with nature. It might be important to interfere with nature, and doctors do it all the time, and they have to, and that's a good thing. But it should be justified. So if there's no justification, we shouldn't do it. Not just in this case, in every case. So why interfere with the natural process that nature designed?
We are robbing the child's experience.
We're depriving the child of a certain experience, and we're depriving the mother also of the satisfaction of being in charge of her own body.
Yes.
We're making her passive. Mm-hmm. She becomes something that we operate on.
Yeah.
Not somebody who actually did what nature prepared her to do.
She cannot live the birth, yes.
Yeah.
And then she cannot heal her own birth.
Yeah.
I think also. And the last question, which emotions count the most in the first 2 or 3 years of life of a human being?
Which emotion should the baby experience, you mean?
Yes.
The baby should experience any emotion that is there. So if the baby feels anger, they should feel anger. If they feel sadness, they should feel sadness. If they feel joy, they should feel joy. If they feel loving and connected, they should feel loving and connected.
What emotion should they receive from their parents?
Well, it's not the emotion they should receive from their parents. All the parents that I know feel love for their children.
Yeah.
But the parents' feeling of love is not what matters to the child. It's important, but ultimately it's not the most important thing. The most important thing is not what we feel, but how we respond to the child. So, if we respond to the child joyfully, because we're really enjoying the child, that makes the child very happy. Mm-hmm. Because the child thinks, oh, I must be wonderful. If the child is sad, and we accept the sadness and we hold the baby, oh, you're sad. Then the child learns that it's okay to feel sad because it'll pass, it'll come and go. So the most important thing for the parent is to be so connected with the child that the parent can experience what the child is experiencing and can share that experience and hold the child in that experience. So if I'm stressed, if as a parent I'm stressed or depressed or anxious, I might love the child, I might have the emotion of love for the child, but I might not be able to connect with the child because I'm too troubled myself. So really, the most important thing for parents is to take care of themselves in such a way that they can be fully present with whatever the child is feeling.
So that the child feels understood.
If the child feels understood and seen,
Yes.
and supported.
Yeah. Thank you so very much.
Well,
And thank you for your wonderful work that you're doing.
Thank you.
Thank you.
My pleasure.